and today I am presenting my paper which I wrote with Dr. Ambika Kamat, The Pathology or Cycle of Hatred, a health humanities analysis of Shingeki no Kyojin Hajime Isayama's Attack on Titan. This research moves beyond traditional thematic analysis to provide a formal psychoanalysis of the protagonist, Eren. We are examining the narrative not just as fiction, but as a clinical case study of untreated trauma. The problem and significance. The central problem we address is the transformation of extreme violence into a catastrophic psychological break. As anime has evolved into a globally bankable literary genre, it has proven its capacity to address profound social and psychological issues. Our significance lies in treating Hajime Isayama's work with the same academic gravity as traditional literature, exploring the intersection of mental health and global conflict. The primary aim and key question regarding this study is to identify the progression of PTSD and, by extension, complex PTSD as core drivers of Eren's psyche. We ask a critical clinical question: how do the caregiver-patient and therapeutic relationships with Mikasa and Armin, the other two side characters, fail to successfully intervene in Eren's pathological decline? We ultimately reframe global conflict as a societal trauma disorder fueled by untreated collective morbidity, as highlighted over there as well. The methodology that I use, this study utilizes a qualitative analysis grounded in Kathy Carroll's trauma studies. We specifically focus on the concept of unclaimed experience. In this framework, trauma is belated. Its true meaning is not found in the violent event itself, but how it subsequently disrupts the survivor's mind and the ability to process reality. And with that, let's come to our big patient, Eren. He represents the case of extreme, complex post-traumatic stress disorder and its progression. Years of chronic existential threat and systematic deception on Parvati's where he lives created a prolonged trauma environment. His quest for freedom is identified as an aggressive compulsion, a maladaptive coping mechanism to regain control in a world that had previously rendered him powerless. When he finally gains the future memories and access to the founding Titan, his psyche fragments. He enters a disassociative state, pursuing time simultaneously, where he gets the power to see not only the present, the future, but also the past, so he's experiencing everything at the same time. And of course, which essentially makes him a slave to the very freedom that he was chasing. Let's go to our caregiver, which is Mikasa Kamat. Mikasa Kamat's role is analyzed as a caregiver burden. Her devotion to Eren's safety leads to the compromised identity and systematic loss of her own identity and autonomy. When Eren mentally assaults her by claiming her devotion is merely servitude, saying "I hate you," he effectively erases her caregiver identity. Her final act of decapitating Eren's head is seen as a clinical necessary intervention and the final elimination of the final identity as a caregiver. A very necessary evil that many people highlight on how a caregiver becomes the ultimate person who intervenes. And then next to the person who takes narrative therapy, which is Armin, he attempts to play the role of a therapist through narrative therapy. He acts as a storyteller using rational discourse and empathetic dialogue to provide cognitive restructuring of Eren's fragmented reality. However, his intervention reaches its therapeutic limit actually. Words cannot bridge the gap created by Eren's deep-seated trauma. And after the war, Armin transcends his patient role to mediate global trauma as a diplomat. He becomes a diplomat who tries to negotiate peace within Paradise and the other world that is remaining now. And of course, this is a cycle of pathology, mostly to do with how unclaimed experiences, clinical failure, and traumatic foreknowledge results in the decline of a human being, and that decline resulting in a global conflict. Coming to my conclusion, ultimately the series is a precautionary tale regarding the terminal failure of health interventions. As we see in the final post-credit scene, if you have noticed, the cycle of war repeats itself. It starts again all over again after people thinking that Eren finally entered the cycle. However, this cycle repeats again where a boy finally goes and gets the powers again. So This suggests that without fundamental healing of the human condition, trauma, and violence remains a self-perpetuating, inescapable loop. And because of this, the global conflict should be diagnosed as a societal trauma disorder rather than an isolated event. And of course, these are some quotes. Our analysis positions this text as a vital case study for the urgent intersections of mental health, the human dignity, and the ethics of care. Thank you.